Feeling better? We are still looking into the underlying causes. What you're looking at, we think may be autoimmune.
But
We'll prescribe you some medication and see how you feel in the future. I'll enter all your data here. Good afternoon, everyone. For our e-patient capstone, we got to work with Christine von Raesfeld, and we brought her vision to life. This is our project titled Invisibility. I'm Angela, and this is Dora, Melody, Mahati, Grace, Justin, and Sarah. We will be taking you through our iterative design thinking concepts that we learned this week at SASI and show you how we were able to take Christine's feedback to develop stronger patient-centered solutions. Now to get started, let's first introduce Christine.
Christine von Raesfeld faced a delayed diagnosis, first with a platelet disorder at 14, then CNS lupus, and suffered severe side effects from medications she wasn't warranted about. Her invisible illness led to mental health challenges and loss of independence, made worse by a healthcare system that misled her about her own body. In response to her past experiences, Christine advocates for early diagnosis through projects like Stanford's Human Wide, raises awareness about medication risks, and found support through her writing and peer groups. She turned her pain into action by founding People with Empathy and speaking out for patient rights and ethical AI.
With that, we were fortunate enough to interview Christine in person, and here were the key takeaways that she brought up. On the slide are some quotes from our interview. During the interview, Christine talked about the HIPAA limitations where patients are not owners of their own data. For example, she had to open up an LLC just to access her own data that other companies and organizations can easily get their hands on. She also touched on the importance of education and awareness on topics such as data and her thoughts on AI in healthcare. Christine also shared her aspirations for the future, as she would like to see people have agency over their own data.
Given these issues that Christine brought up, we applied our design thinking skills and came up with a few how might we questions. Our two statements that we came up with were how might we give true ownership and control over a patient's own data, and how might we help Christine close a HIPAA and DID loop in order to keep patient private data safe. Just for some context, HIPAA is a system put in place to protect the privacy and security of an individual's health information, and a way to do that is through de-identification, which is information that has personal data removed so that the data cannot be linked back to the individual.
Guided by the design process, we identified a core problem and created 3 initial concepts based on Christine's initial concerns. First is the digital platform.
We create a micro LLC, limited liability company for each patient, turning their health data into a protected asset. That means companies must license it under your terms, like nonprofits only or AI training only. The system is funded by institutional licensing, grants, and optional upgrades like health reports or genetic counseling.
We want our patients to be clearly informed about where their de-identified medical data is sent and how it is used. The LLC manages licensing of this data on behalf of patients without owning it. Patients have full control and can grant or revoke permission from any third party to access their data at any time. Only authorized organizations with proper licenses can access the data, protected with encryption through the usage of local servers, bound by HIPAA and the California Consumer Privacy Act. which is essentially to know what personal data is collected about them, and that they can request for companies to delete or stop selling their information, and they can receive a copy of the information they give.
Another issue that patients face is that people need ways to have control of their data at clinics, research sites, or in emergency situations. Therefore, our solution is a physical keychain tied to the patient's LLC and digital wallet. This allows an instant display of data licenses, for example, federated AAs only. It also has access to emergency info if the patient allows it. It has one-tap data revocation or consent toggles, and review of smart contract logs and usage history. This works because it brings data governance into physical space, enables point of view enforcement, and also, most importantly, protects patients who might not otherwise have digital access.
Now we're going to move on to the feedback Christine gave us. After finalizing our first draft, we met with Christine again to refine our capstone. For the digital platform, she recommended milestone notifications and emphasized encrypting patient data. We added settings so patients could control whether their data was public, research only, or private. And inspired by a research she shared, we added a visualization option to see genomic data using interactive DNA maps. For the physical product, we addressed security concerns with password protection. And on the policy side, we focused on advocating for federal laws to prevent data misuse. On this slide, you can see our improved app visualization based on some of her feedback. We have an encryption system, and we also implemented a personal health data vault that allows users to input all of their medical history. Here on this slide, you can also see that we had different settings options, and users could also have the option to create their own LLCs.
Looking ahead, we're focusing on 3 key areas. First, refining in-app features by integrating AI specialists to help users understand their genomic data. Second, keeping our physicians and healthcare professionals in mind, we aim to format our digital platform to present patient data in a clear, accessible way to track habits and symptom patterns. And lastly, we will continue to prioritize youth education, as we believe that through literacy, empathy, and understanding, the younger generations can also drive future breakthroughs in society.
We all hope you enjoyed the presentation. Thank you so much for listening, and does anyone have any questions?